Hello and welcome. You are watching Step Up Medicine's video on the key spinal tracts. Make sure to also check out our video on advanced spinal tracts. You feel pain in your toe, but your brain knows exactly where it came from. You move your arm, and your muscles respond instantly. That's because the spinal cord isn't just a cable, it's a two-way communication superhighway. In this episode you'll learn the major ascending and descending spinal cord tracts, how they carry sensory and motor information, how to recognize tract lesions clinically, and how to decode classic findings like loss of pain, vibration, or motor function. Let's get our bearings. Life on Spinal Tracts. The spinal cord is organized into white matter tracts and gray matter horns. White matter contains myelinated axons, bundled into tracts that carry information up and down. Gray matter contains neuronal cell bodies, where processing occurs. We divide tracts into two groups. Ascending tracts carry sensory information to the brain. Descending tracts carry motor commands from the brain. This pathway carries fine touch, discriminative touch, like reading Braille, vibration sense, and conscious proprioception. Your awareness of joint position and movement. It involves two neurons. The first-order neuron enters the spinal cord and ascends ipsilaterally in the dorsal columns. Fasciculus gracilis carries signals from the lower body. Fasciculus cuneatus carries signals from the upper body. It crosses at the medulla, then ascends to the thalamus via the medial lemniscus. 2. Spinothalamic tract, part of the anterolateral system. This tract carries pain, temperature, and crude touch, poorly localized touch or pressure. First-order sensory neurons synapse quickly in the dorsal horn, and second-order neurons immediately decussate via the anterior white commissure. From there, they ascend contralaterally all the way to the thalamus. Clinical tip. A unilateral spinal cord lesion here causes contralateral pain and temperature loss, beginning a few segments below the lesion. 3. Spinocerebellar tracts. These tracts carry unconscious proprioception, information about muscle stretch and joint position that goes to the cerebellum for coordination, not conscious awareness. There are two main pathways. Dorsal spinocerebellar tract carries signals from the lower limbs, remains ipsilateral, enters the cerebellum via the inferior cerebellar peduncle. Ventral spinocerebellar tract, also from the lower limbs, but it double crosses, once in the spinal cord and again in the cerebellum, so it ends up ipsilateral as well. Clinical tip. Damage to spinocerebellar tracts leads to ataxia, uncoordinated movements, without loss of conscious sensation. An upper motor neuron is a motor neuron that originates in the cerebral cortex or brainstem and travels down the spinal cord. It does not directly innervate muscle, it synapses with a lower motor neuron. A lower motor neuron is located in the anterior horn of the spinal cord, or cranial nerve nuclei. It projects to skeletal muscle, directly causing contraction. Think of UMNs as the command center, and LMNs as the final delivery system. Lastly is the corticospinal tract, which is a descending spinal tract. It begins in the primary motor cortex, precentral gyrus. Axons descend through the internal capsule, travel through the midbrain and pons, and reach the medulla oblongata. Here, about 85 to 90% of fibers decussate, cross over, at the pyramidal decussation in the medulla. This forms the lateral corticospinal tract. These fibers then descend in the lateral column of the spinal cord and synapse onto lower motor neurons in the anterior horn. The remaining 10 to 15% of fibers form the anterior corticospinal tract, which may cross at the spinal level or remain ipsilateral, contributing to trunk muscle control. Let's look at 3 classic spinal cord injury patterns and what they tell us. First, Brown-Séquard syndrome. This is caused by a hemisection, or one-sided damage, of the spinal cord. You'll see 3 key findings. Ipsilateral loss of vibration and proprioception, from damage to the dorsal columns. Ipsilateral weakness due to damage of the corticospinal tract. And contralateral loss of pain and temperature because the spinothalamic tract crosses early in the spinal cord, so same side for motor and position. Opposite side for pain and temperature. Next, anterior cord syndrome. This affects the front 2/3 of the spinal cord. You lose pain and temperature sensation below the lesion, due to spinothalamic tract damage. You also get motor weakness, from corticospinal tract involvement, but the dorsal columns are spared. so vibration and proprioception remain intact. Finally, posterior cord syndrome. This is less common, but very distinctive. You lose vibration and position sense from dorsal column damage, but motor function and pain sensation are typically preserved. Let's review the key spinal cord tracts. Ascending tracts carry sensory information up to the brain. The main ones are DCML, for fine touch, vibration, and proprioception. It crosses at the level of the medulla, spinothalamic tract, for pain and temperature. It crosses at the level of the spinal cord, crustina. Now for the descending pathway. Crustina, 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 crustina tsed, crustina, 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 crustinum hans. The crustina commands, crustina prustina, crustina brain, crustina, crustina tsed, crustina commands, crustina brain to the body. It controls voluntary movement and crosses at the medullary pyramids. Remember, DCML, delicate sense, spinothalamic, sharp and hot, corticospinal, movement on command. Here is a quick question to test your knowledge. Now, quiz time. Question 1. Which tract carries pain and temperature sensation? A. DCML, B. Corticospinal, C. Spinothalamic, D. Spinofibellar. Drop your answers in the comments. If this helped clarify your basics, like and subscribe for more high-yield videos. Up next, we will be taking a closer look at some more advanced spinal tracts. Thanks for watching, and keep stepping up your knowledge.